this indication. This indication will be the support BellaVie Woman as a support, as an efficient support, scientifically proven for the menopausal woman. As you already know, our body hosts an estimation of 39 trillion microbial cell, including bacteria, viruses, and mycoses. They are mainly located, as you see, in the gut. This bacteria, when it gives a good beneficial effect to the body, it's called the microbiota. Microbiota, based on the WHO definition, microbiota should be alive and active in the site of action, in this case in the colon, should be active and alive in order to perform those beneficial effects to the body. Then it should be alive and active. Okay, now what are those beneficial effects to our body? Mainly, this will promote, it will aid digestion in all kinds. It will synthesize essential vitamins like the vitamin K, the complex B, converting the vitamin A into retinoic acid. It will assist the production of biosynthesis of vitamin E and the coenzyme Q10. Okay. At the same time, it will regulate the immune system, combat the inflammation, protect against harmful pathogen. A balanced microbiome will contribute to the metabolic well-being in our body and support the mental health as well. Okay, allow me to present some concepts in order to understand why BellaVie Woman could help and could assist and could be a good support for the menopausal woman. As I explain now, in the site of action, the bacteria, the good bacteria, our microbiota, and the environment, which is called microbiome, should be alive and healthy. When we ingest undigestible fibers, and those fibers will reach the colon undigested, since they are undigestible fibers, the good bacteria, alive and healthy, will ferment in the colon those fiber and produce automatically what we call short chain fatty acids. Those short chain fatty acids are three kinds of fatty acids. As soon as they are produced, they are absorbed by the colonocytes, okay, transformed into acetyl coenzyme A, and then enter and support the Krebs cycle in order to produce the energy for the body. Okay, now we are talking in the colonocyte. Okay, now this energy are mainly used at the beginning by the colonocyte, by the colon, in order to establish a good homeostasis phase, and at the same time stop the leaky gut, and I will explain about the leaky gut later on. For only 5% of those short chain fatty acids are excreted. When the remaining quantity of this short chain fatty acid, after performing in the colon and giving all the needed energy for the colon, are absorbed to the bloodstream. When absorbed to the bloodstream, they are transported to site of action where their receptors are located. They have many receptors in the body. They have receptors in the intestine, in the fatty tissue, pancreas, brain, nerves, immune cells, bones, liver, and the immune system, the lymphs. Now, in order to go to, while going to those site of action, they produce kind of, they establish kind of axis between the colon and those organs, like the gut-brain axis, where the short-chain fatty acid produced, like as I said, undigested fiber will meet healthy bacteria producing acetate, propionate, and butyrate, the short chain fatty acids. Those short chain fatty acids are transported in very fast, 95% of them, in the colonocyte, where they act here to take all the inflammation off, and the rest, the remaining quantity, will go to the immune cell, forming gut immunity axis, gut metabolic axis, going to the liver, to the pancreas, and to the fatty tissue, and the gut-brain axis. Now, some literature are talking about gut lung axis, but which is finally the gut immunity axis. Okay, then those are the three short chain fatty acid. The acetic acid with 2 carbon, as you see, the propionic with 3 carbon, the butyric with 4 carbon. The butyric acid is mainly used due to many carbon, then produce a lot of energy in the colon. Then it's first used in the colon. The rest, usually, they go to in the axis going to the liver, the pancreas, the brain, and the immune system. Okay, at the same time, okay, the benefits of those short chain fatty acid, as I said, source of energy, very important. They give 10% of the required daily caloric needed calorie in the body. They regulate the inflammation, and it's a very important feature. They maintain intestinal homeostasis and re-establish the barrier integrity. They regulate the gut-brain axis by producing 5-HTP, I will explain later, which will be converted to serotonin in the body. Since 90% of the serotonin is produced by the gut, then between the gut and the liver, and not in the brain. Brain will produce its own serotonin, enhance the immune system, and impact the lipid and glucose metabolism. Since not everybody is in the medical field, when you will ask me questions, please write them down and I will be answering at the end of the presentation. Now, when we have a healthy bacteria, a healthy microbiome, a very well integrated bacteria in our body, we call it a phase of eubiosis. Now, I will introduce the phase of dysbiosis, where it's an imbalance in the bacteria. The good bacteria will decrease, and pathogen and bad bacteria will increase, causing many problems and many illnesses to the body. What is the cause of this dysbiosis? The cause is processed food, pesticide we eat in many food, alcohol, pollution, microplastic. Now, more and more studies are showing the effect of microplastic. We all ingest microplastic daily. The stress due to the cortisol, the menopause, the diseases like inflammation and autoimmune diseases. Many medication could cause dysbiosis, such as the PPIs, the statins, the metformin, the non-steroidal anti-inflammatory drugs, and the antibiotics. Dysbiosis can cause many illnesses, and now we are studies are discovering many of them. Even the autism is linked to dysbiosis. Okay, then dysbiosis first cause many intestinal inflammation, leaky gut, autoimmune inflammation like the IBS, IBD, Crohn, etc., lung infection, obesity, type 2 diabetes, lack of immunity, skin problems, heart problems. The gut brain will cause many depressions, psychiatric disorder, etc. Okay, I will go to the second concept, which is the gut barrier integrity and the gut leakage. As you all know, our colon should be very like with good integrity in order to protect the product, all the bacteria and the food from the lumen, from the intestine, to go into our bloodstream and the inner body. Because if they go to this part of our body, it will cause inflammation, and then it will disturb and cause many problems to the body, because all the axis I was talking about will be interrupted. Okay, how this works: if we eat low fiber and we have a dysbiosis due to many causes, this will produce a toxin called zot-like toxin, which will go to the receptor part 2. Okay, this receptor will go as a signal and activate protein kinase alpha, an enzyme which dephosphorylate the link between the colonocyte. Then we have 3 protein to link the colonocyte and have this integrity: the occludin, the claudin, and the F-actin. If we re-establish a good eubiosis phase and then good microbiota, and we ingest good fibers, undigestible fibers, we produce the short chain fatty acid as explained. They will go to their receptors, especially the GPR41. Thus, they will activate the protein kinase beta, an enzyme, and they will rephosphorylate those protein. Then they will reconnect the colonocyte together. Then they will the human body will have an integrity in its colon, and it will be a separation between the inner body and the lumen of the intestine. And then the energy produced by the short chain fatty acid can act as anti-inflammatory and re-establish, take off the inflammation from the colon, and re-establishing a good functioning of the axis I was explaining. My third concept, called estrobolome. As you know, especially here, I'm talking about a woman. The estrogen is produced by the ovary and many other organs like the fatty tissue. After doing the work, the estrogen will go to the liver, which where it is conjugate. Please go ahead. Somebody was asking something? Then the estrogen will go through metabolism action in the liver. It will be conjugated, sent to the intestine. Now we have the bacteria. A part of our microbiota is called the estrobolome. Estrobolome are bacteria. They can produce an enzyme called beta-glucuronidase. This enzyme can deconjugate, then separate the estrogen from the other part and reactivate the estrogen and resending the estrogen to the bloodstream to be active again, then reactivate estrogen. This estrobolome will work with signals. If the body is in need of estrogen, then the estrobolome will be active and will send the active estrogen again to the bloodstream. If the body is not in need of estrogen, as you know, a high quantity, high level of estrogen in our body will cause cancers and many other problems. Then if the body is not in need of the estrogen, the estrobolome will be in low activity and will keep the conjugate estrogen conjugated and will send it defecated in the fecal excretion. I will repeat very quick in case somebody did not follow well. Then the ovary usually produce the estrogen. After finishing their action in the body, they go to the liver, where they are conjugated because they are metabolized and the action is finished and sent to the intestine. In the intestine, we have a part of our microbiome part of our microbiota, when alive and active in good health, a part of this microbiota will produce the enzyme called beta-glucuronidase. This enzyme will deconjugate the estrogen and reactivate the estrogen, sending it again in the bloodstream by absorption in the intestine. But this estrobolome, those bacteria could be very active if the body will send a signal, I need estrogen. If the body will send a signal, I don't need estrogen, I have enough, the estrobolome will be in low activity, keep the estrogen conjugated and send it to the fecal excretion. Now, as you know, in menopause, ovary will not produce the estrogen, but the adipose tissues, the fatty tissue and other organ will produce a small quantity. Now, once this small quantity conjugated, the estrobolome certainly will have a signal, we need estrogen, we don't have enough. Our body will, then the estrobolome will deconjugate the estrogen, resending it in the bloodstream. Okay, this is the estrobolome. Menopause, as you know, is a natural phenomenon. It consists of a decrease in production of estrogen, divided in three phases. The perimenopause, between 2 and 8 years, where we have a transition between period and non-period, then it will be a disturbance in the cycle of a woman. Menopause, it's where we have the most of the symptoms, and it's a permanent cessation, at least for 12 consecutive months, of estrogen production and of period. Postmenopause, where dangerous symptoms are have place, especially the cardiovascular and osteoporosis. The menopausal symptoms are the mood change, the anxiety, the stress, vasomotor symptoms like the hot flashes, the night sweats, recurrent urogenital infections, brain fog, insomnia, inflammation, many intestinal inflammation, vaginal dryness, gain weight, joint ache due to the inflammation, and in the postmenopausal woman, we have the osteoporosis and the cardiovascular diseases. Okay, there is a big link between the dysbiosis and the menopause, especially in the vaginal area and the intestine area. Why? Because the production of glycogen will be lower, giving a pH to be higher, then less acidity. When the acidity will go higher than 4.2, we start seeing pathogen living and mycosis living. This is why it will create a dysbiosis in the vaginal area and the intestine, causing the estrobolome to stop at the same time. And this is why dysbiosis is linked to worsening the menopause symptoms. Please follow with me this figure. Estrogen at birth, when the fertile phase of a woman, we have a steady estrogen. Then in the menopause, it will drop very low, not to zero, but very low. If we re-establish a good eubiosis phase, a good living bacteria, and a healthy microbiome, then the estrogen will go again in acceptable levels. At the same time, the vaginal epithelium, during the menopause, it will shrink, giving dryness. When we give the probiotics, when we re-establish a good bacteria, a living bacteria and healthy microbiome with no inflammation, then we will have another epithelium going thicker, a little thicker. Glycogen, as I said, will decrease in the menopause. elevating the pH, then giving a higher acidity, then less acidity, sorry, then higher pH, less acidity, which will promote a dysbiosis, as you see here, by re-establishing a good bacteria, a good microbiome. Then we can see again a low pH, especially this area is colonized by Lactobacillus. Lactobacillus will produce lactic acid. Lactic acid will give place to acidity, and acidity will re-establish with when we give good bacteria a life. It will re-establish a good microbiome and a healthy vaginal area for menopausal women. I was talking about oestrobolome. Oestrobolome, two species of bacteria can produce the Lactobacillus rhamnosus and Bifidobacterium lactis produce the beta-glucuronidase. Once we establish a good microbiome in our intestine, the oestrobolome will be active again. Okay, it reduce hot flashes, night sweats, it improve the foggy the stress, the foggy brain, and as I said, it will re-establish a good microbiome in the urogenital area. Lactobacillus acidophilus, well known to boost the immune system, improve the digestion, take off the inflammation in the intestine. The Bifidobacterium longum improve the low mood, the disturbed mood, the anxiety, and the depression. A small summary on this subject. During menopause, the enteropathic cycle is what the estrobolome re-injecting the estrogen in the bloodstream. Then when we have the menopause, we have a dysbiosis. Dysbiosis will decrease the beta-glucuronidase, stop the estrobolome, increase the presence of pathogens, and less estrogen reactivated. Okay, this will give us, as I explained previously, all the symptoms. When we give, re-establish a good microbiome by giving the good probiotic and delivering those bacteria alive to the site of action, we can restore a beneficial bacteria in the intestine and the vaginal area for the menopausal woman, enhance the estrobolome to work well, reactivate the gut-brain axis, taking off many of the depression and the foggy brain and the mood and the insomnia in this menopausal woman. Take off the inflammation, then take off all the symptoms in the intestine, and improve the gut barrier, restore the vaginal urinary microbiome balance by normalizing the pH, as I explained, by the secretion of lactic acid, of H2O2 as well, the peroxide of hydrogen, which kills the pathogen, and the secretion by those bacteria of bacterocin, an antibacterial substance. It promotes the metabolic process, as I said, with the axis of when we take off the inflammation, we re-establish the axis between the gut and the pancreas and the liver. Thus, we will increase the metabolism of the fat, and at the same time, we increase the metabolism of the glucose. BellaVie Woman, you all know our concept of symbiotical. Probiotic, prebiotic give symbiotic. Probiotic, in order to be called probiotic, it should be delivered alive to the site of action. We should give fiber without the undigestible fiber, and many companies don't put those prebiotics, the fibers, with the product. Then together they will give the symbiotic, and when we add nutraceuticals, it will be symbioticals. Nutraceutical in BellaVie Woman, you all know it's the cranberry extract, well dosed at 36 milligram of PAC, proanthocyanidine, in order to combat the UTI, urinary tract infection. This is the composition of our BellaVie Woman. As I said, I mentioned those bacteria. All those bacteria work in the favor of reestablishing a good homeostasis phase in the intestine and in the vaginal area. The prebiotic are the fibers, undigestible fibers, in order to be fermented by our bacteria and produce the short chain fatty acid. And the cranberry extract is to take off all infections from the urinary tract specifically. We have benefits, many benefits in BellaVie Woman. Made in Belgium, the bacteria are safe and with no contamination because it's European standard. We deliver alive the bacteria due to the gastro-resistant capsule. Then we avoid the acidity of the stomach, which will kill the bacteria, and deliver them to the colon not alive. We have innovative formula, then we have different product. Each product will have different bacteria based on study. And we have different food supplement as well, nutraceuticals. Broad spectrum, each one of our product, including BellaVie Woman, will have different strains of bacteria. And those strains of bacteria will give a broad spectrum of action to our product. We have in BellaVie Woman 10 billion CFU per capsule. Then we deliver a good quantity of living bacteria to the colon. Our product is vegetable caps and halal certified. We use the Bacillus coagulans as a heat resistant and very effective bacteria. If you forget your package in the car during summertime, nothing will happen to this bacteria. It will stay alive because it's a spore-forming bacteria. And we put our capsules in triplex blisters, not in jar, in order to protect our bacteria from moistures, avoiding any loss of living bacteria in our product. BellaVie Woman can alleviate the stress, as I explained, by taking off first the inflammation from the intestine, re-establishing this gut-brain axis. The intestine will secrete the 5-HTP, which is the 5-hydroxytryptophan converted in serotonin in the liver. And as I said, 90% of the serotonin, which is an antidepressant, good for insomnia, good for mood change, etc., is produced in the gut and not in the brain. This is why by re-establishing this axis of gut-brain axis, we can take advantage of having serotonin in our system and taking off many of the symptoms of the menopausal woman, especially related to the stress and the insomnia and the anxiety. Short chain fatty acid alleviate the stress, decrease the depressive symptoms, decrease the hormonal response to acute stress, and increase the secretion of HTP, 5-HTP, as I explained now. This BellaVie Woman at the same time re-established the gut integrity I explained before by activating the PKC beta and rephosphorylating those 3 proteins to reconnect the colonocytes and regain a good potentiality, a good barrier between the lumen and our inner body, avoiding any inflammation. Then it takes off all the inflammation and it will block the HDAC. This is why it will block the inflammation in many places, in many sites in our body. This is to prove that if we ingest the bacteria, because it might be a question, how can we recolonize the vagina of a woman? It's well known and proven, even with studies we conducted, BellaVie conducted in a hospital in Turkey called Maslak Hospital. that the bacteria ingested will recolonize by migrating through the perineum to reach the vulva and recolonize the vagina. But in order to do so, it should reach the colon alive. Otherwise, it cannot migrate, it cannot be active. This is why it should be alive in the colon in order to go through the rectum, migrate, and recolonize this area again. Once recolonized, it will produce, because we choose the Lactobacillus and Bifidobacterium as bacteria and specific strains, they will produce lactic acid, then decreasing the pH, increasing the acidity, taking off all dysbiosis, making the place very good for the good bacteria. They will produce, some of the strains will produce peroxide of hydrogen. They will kill the pathogen as well. And they will produce bacterocin, another antibacterial substance, in order to kill the pathogen and keep the good bacteria living in this area. Okay, Lactobacillus is the best lactobacillus for the genital area of a woman. This is the study we conducted in BellaVie WOMAN as a finished product. We can see in a woman having dysbiosis, then the number of good bacteria increased, where in metronidazole, metronidazole killed the good and the bad bacteria, keeping the space open for recurrent infection. In our case, BellaVie WOMAN, we re-establish a good flora in the bacterial, in the vaginal area. At the same time, we took off the biomass of Candida albicans and we replaced it by a biomass of Lactobacillus and Bifidobacterium, then re-establishing a good microbiome, a good population of good bacteria in this area. Bacillus coagulans provide benefits to women being treated with antibiotics and cure the bacterial vaginosis. We are talking about Bacillus coagulans alone. In our case, we have many other bacteria and all work as synergy. It will reduce the Lactobacillus crispatus, will reduce the time of recurrence and take off many recurrent infections. Then it will reduce the number of recurrent infection and increase the space between any recurrent infection. Okay. Lactobacillus rhamnosus, at the same time, it will be a good alternative for treatment for most common indication in the gynecology area, all kind of infection in this area. Then to summarize, BellaVie WOMAN in the vaginal area, it's a non-hormonal approach for based on microbiology to treat all kinds of infections. A reduction of the vaginal pH, making the environment very good for favorable for the good bacteria, the lactobacillus, restore the protective flora, produce bacterocin, and targeted mainly the Lactobacillus crispatus and rhamnosus, prevent the pathogen from adhering to the vaginal area. As I said, by re-establishing a good axis, especially here the gut metabolism axis, we can assist a woman, this product can assist a woman to a menopausal woman to control the weight by increasing the metabolism, the fat metabolism and the glucose metabolism. Inulin is produced from a chicorée, a well-known plant in Belgium. This inulin is a well-studied prebiotic, then it gives a good prebiotic in order to produce this short-chain fatty acid. Okay, and the cranberry will give us a good protection for the urinary tract by avoiding any sticking between the Escherichia coli or other bacteria to the wall of the bladder and the urinary tract. then this alone could be a good treatment for the urinary tract infection. Then BellaVie Woman and the menopausal woman help controlling the overweight, manage the sugar and fat metabolism, protect from recurrent urogenital infection, alleviate the vasomotor symptoms, the hot flashes and the night sweats, reduce the anxiety by activating the gut-brain axis, alleviate the IBS and intestinal cramp, increase the immunity and modulate the immunity and decrease the infection. And thank you very much. I hope I was clear enough.
Thank you, Dr. Adel. Thank you
Thank
for
you.
the informative presentation.
Thank you very much. Thank you. I am ready to try to answer your questions. Mrs. Maya, nice meeting you.
Hello. So far, I don't have any questions, not right now.
Okay.
I need to digest this a little.
Anyway, I'll be ready to answer your question as usual via email with no problem.
Okay.
Hi, Mr. Adel.
Hello, how are you, Dr. Anas? How are you?
This is Anas from Iraq. Thank you.
Yes, how are you?
I'm fine, thank you. Really, many thanks for this very informative session. It's full of knowledge and to know more about our product. Please, I have 4 questions. I will go fast in them. Okay.
Okay, let's go one by one in order to be more
Great.
to be ready to answer. Go ahead,
Okay.
please.
The first one, during the session, you said there is a mechanism of sending signals from the body to the bacteria, to the estrobolome,
Yes.
to make sure there is no high level of estrogen, unconjugated
If the
estrogen.
body needs estrogen, the body will send signals, yes.
Yes.
to
My
the
question,
estrobolome, actually to the intestine, to the receptor of the
Exactly, because at this point, maybe the physician, they said that what about the increasing of high level of estrogen? Then we get the again a side effect. It seems like
Okay,
the body
you are
gave
talking about the
an extra dose.
HRT.
So I'm asking about what is the mechanism of sending the signals? Is there something clear? Because the body will treat with this case?
Okay. Honestly, the signal, what I know about it is a signal through the intestine, but I'm not sure what is the real molecule the body will send to. But what we are sure about is the estrobolome will not be active if the body have a saturated estrogen level. Okay, during the menopause, the body is always in need of estrogen. The level is very low. And more we know that the hormone replacing therapy especially starting after the age of 60 is harmful.
Yeah.
Okay, between 50 and 60 is showing some advantages. After the age of 60, more and more schools in medicine are avoiding this. This is why by letting our body taking this estrogen again when needed, it is a natural phenomenon. Actually, we are reactivating a natural phenomenon. We are not imposing to our body any quantity of estrogen.
Okay, thank you. For the second question, what's the best timing to use BellaVie WOMAN? I mean, in the period of premenopause or menopause, or even in postmenopause.
Thank you very much for this question.
We will know exactly the patient profile.
Okay. BellaVie WOMAN is a food supplement. Then it's safe and it used all the bacteria usually existing in our body. This is why a woman, even if a woman will take the BellaVie WOMAN, as you know already, before perimenopause, there is no problem because she will be protecting herself from recurrent infections and re-establishing a good homeostasis phase of her intestine. Now, perimenopause, menopause, and postmenopause, the early this lady will start using, and not because it's better not to reach this dysbiosis. It's better to start early, avoiding any dysbiosis. You know, there is a link, as I said, between the menopause and the dysbiosis. The more we avoid establishing this dysbiosis by ingesting probiotics, living bacteria, and colonizing the intestine and the vaginal area by those bacteria, we will avoid establishing a dysbiosis and causing problems. Then the earlier the better. And since we are not ingesting any hormones, then it could be at any time, but the earlier the better. That's for sure.
Thank you. So the earlier is the better. Very great.
Yes.
The third question is related to this question. If we have a patient that catch this opportunity to use BellaVie WOMAN, but it reached the postmenopausal, my question, we will get the same positive impact on the clinical manifestation when using BellaVie WOMAN, even in postmenopausal women, like the perimenopausal?
No. Postmenopausal, it's a very dangerous phase for the woman. Okay, first she should be followed by her OBS-GYN. But what we can claim in the postmenopausal woman, we cannot tell her, okay, actually we increase, those bacteria will increase the absorption of calcium. But we cannot claim anything about osteoporosis and cardiovascular diseases. But we can claim that, as I showed in my presentation, that the vaginal dryness, the vaginal problems will be, then all those symptoms, all this problems this lady will be facing will be less if she will start in the postmenopause. For sure, the advantage will be less, but she will feel a difference in the dryness and the itching and the recurrent infection, etc., because she will be colonizing this area by good bacteria, avoiding any recurrent infection, and she will be avoiding at the same time the intestinal problems, but not we cannot claim about the cardiovascular and the osteoporosis.
Okay, thank you. The last question, I'm sorry.
No, go ahead.
Thank you. The last one. In your presentation, you said BellaVie WOMAN may be alternative to metronidazole according to
our study, yes.
Yes. So my question, what's the impact of using antibiotic plus BellaVie WOMAN? You know, the gynecologist may be put a certain regimen and contain antibiotic to the patient. And adding
Anas, thank you for those good questions. I think everybody's taking advantage. If we use antibiotic with, first let me start with the study we conducted in Maslak in Turkey. This study, we used metronidazole alone and BellaVie WOMAN alone. And the difference I showed you that in metronidazole killed this bacteria, but did not cure the dysbiosis, because while killing the bacteria, it could kill the good bacteria as well, causing a dysbiosis. Okay, letting a place for bad bacteria to come and for Candida albicans and other kind of mycosis. In our cases, we will be killing those bad bacteria, but colonizing the vagina with good bacteria and increasing the biomass of Lactobacillus and Bifidobacterium and decreasing the biomass of Candida albicans. Okay, now if we take antibiotic and BellaVie WOMAN together, in case of it's based on which antibiotic you choose, because as you know, antibiotic have spectrum. If the spectrum of the antibiotic you use include the Lactobacillus we use, then the antibiotic will kill our bacteria like killing other bacteria, but it will not kill the Bacillus coagulans. which is an
Okay.
antibiotic resistant. Okay, then we have a
Okay.
small advantage, but usually we don't, unless you use a very wide spectrum antibiotic with very wide spectrum. Usually we can use our product, then BellaVie WOMAN, with the antibiotic, keeping some of our bacteria alive to protect. At the same time, we will be, while taking the BellaVie WOMAN, we will be taking the cranberry extract and cleaning. But for sure, we have to continue, in this case, 2 weeks at least after the antibiotherapy, in order to be sure that we recolonize for this woman the urogenital area with good bacteria.
Thank you. Thank you so much.
Thank
Thank you. I
you.
have finished. Thank you.
Any other question?
Yes, Dr. Ate, if I may.
Yeah, please go
This
ahead.
is Bashar Ghanam from KSA.
Yes. Hello, Dr.
My
Bashir.
first question is related to the count of bacteria. You mentioned
Yes.
that BellaVie women have 10 billion
Yes.
count.
CFU, yes.
Yeah, CFU. My question is there a specific guidelines for the amount of bacteria? Yani, in other words, if I'm going to say that we have 10 billion counts, CFU count, comparing to what? If I was asked by the physician.
Okay. Thank you very much for the question.
I have another question when you finish, please.
Thank you very much. Thank you. For your question, probiotics usually, as I said, we have 39 trillion bacteria in our body. 90% of them are in the intestine. When you give only 10 billion, it's not a therapeutic, meaning it's not a medication, and we go by if we give 5 billion or 10 billion. I give 10 billion. Actually, if I want to compare it, I compare it to the competition. Most of the competition, I mean the serious competition, are using less CFU. Second, they are not using gastro-resistant capsule. Then they are not delivering their bacteria alive to the site of action, because those bacteria are going through the acid of the stomach, therefore killing the bacteria. Three, if you give 10 billion or 5 billion, etc., the more you give, the faster you get to the eubiosis, to the good homeostasis phase in your intestine. Okay, then it's not a medication. It's a good support aiming to reestablish a good bacterial. Actually, maybe some of our distributor or present with us from Ramida, Egypt, they have a great experience with those bacteria in the IBS now, and during the before the IVF, preparing for IVF, and many other indications. Then yes, 10 billion is a good CFU. But it's not, you cannot say we have like a lethal dose or a therapeutic dose. We are supporting our intestine with living bacteria in order to reestablish a healthy microbiome, in order to reestablish good access between the gut and the brain and the metabolism and the immunity.
Thank you. Thank you very much.
Thank you.
My second question is related to the indication. Is there a duration of treatment related to each indication, or shall we consider it as a supplement and the patient should use it for a long time? Because you mentioned before when with the previous question from Dr. Anas, if I'm not mistaken, from Iraq, he was you answered about the duration that the patient should take BellaVie minimum for 2 weeks after the infection.
Yes, no, if you have an infection, like let me be related to the study I mentioned previously. We gave the ladies with the vaginal dysbiosis, okay, then we gave them 2 capsules per day of 10 billion for 7 weeks, and we got this result. Okay, then in case of infection, we advise, at least for 7 days, to have 2 capsules per day. Now, as a support, in order to avoid any recurrent infection, yes, we can consider it as a supplement and take it as much as we can, or have a course like some of the markets are doing, proposing a course of 10 days per month in order to be sure that we have a continuous eubiosis phase and not having a dysbiosis established in the intestine or the vaginal area. Then the duration of action of treatment we have, mainly it's 7 days to 10 days, 2 capsules per day, if we have an infection like acute infection.
Thank you, Dr. Adel. Thank you very much.
Thank you.
Hi, Dr. Adel. I'm
Yes,
Hassan
hello.
from Iraq.
Yeah,
Dr.
hello.
Hassan
How
from
are
Iraq.
you?
I'm fine. Thank you for your informative presentation. And I have 2 questions. The first question is, how can the bacteria or the lactobacillus reach the vagina?
Okay.
And what is the route?
Thank you very much for the question. Allow me just to go back to one of my slides. This is the slide. As I explained, when we ingest the bacteria, it should go through the stomach, as you know. If the bacteria is not protected, it will be killed here and the journey will stop here. This bacteria will reach the intestine as postbiotic, then dead. Then we protected with gastrointestinal, gastro-resistant capsule. Then it will be delivered to the colon alive and in good health. Then it will live in this area in the colon, excreted, going through the rectum, going through the perineum, and then to the vulva, and then colonize the vagina. Many studies are showing this, and even our study in Turkey showed the same, colonizing the vaginal area by the mouse.
Okay, thank you.
Thank
My
you.
second question is, how can BellaVie WOMAN lowering the acidity and increasing the pH?
Very good. As you know, let me show you. Sorry to go through my presentation because it's easier. We use Lactobacillus acidophilus, Lactobacillus crispatus, fermentum, and rhamnosus. Especially the acidophilus and many other species, they produce lactic acid. Always, when alive and in good health, they produce lactic acid. Lactic acid is an acid. It will higher the acidity, lowering the pH. This is your question for the pH. But at the same time, those strains produce H2O2, then produce peroxide of hydrogen, which will kill the pathogen, and produce bacterocin, which will kill the bad bacteria as well. But for the acidity, it's the production of lactic acid. I hope I answered.
So I asked you how BellaVie decrease the acidity.
BellaVie increase the acid and not decrease the acid. Increase the acid and decrease the pH by producing the lactic acid.
Increasing. Okay.
Okay, we need an environment of pH between 3.2 and 4.2, or 2.4 and 4.2 in order to be more accurate. In order to have this kind of acidity, our lactobacillus, not only even in the nature, a normal woman, healthy woman, a woman have lactobacillus in her environment, vaginal environment, and producing this lactic acid in order to preserve this acidity level.
Okay, thank you. Thank you, sir.
Any other question?
Yes, Dr. Adel, with you, Mohsen from KSA.
Yeah, okay, nice meeting you.
Please, I need to ask about the safety during pregnancy.
I'm sorry, would you please repeat the question?
I need to ask you about the safety during pregnancy.
Okay. Listen, it's very important to know the first 3 months of a pregnancy, we cannot recommend any product, any of them. Okay, this is important to know. Now, after the first trimester, starting the fourth week, usually there is no problem, and we can use food supplement based on the advice of the GYN. But it's safe starting the 4th month. But the first trimester, nobody can claim anything without very tough study, very enlarged studies.
Okay, doctor, thank you very much.
Thank you. Yes.
Okay. One question. There were great questions.
Go ahead.
Yeah, I have it at when I talk to pharmacists and doctors. What would you recommend the duration? We talked about it. So at least 2 weeks after antibiotics,
Yes.
and somewhere 10 to 20 days if there's symptoms. Is that correct?
Yes. If there is, this is why I mentioned, if we have an acute infection, then we have symptoms, then it's at least 10 days to 14 days, 2 capsules per day. And
Yeah.
post antibiotic, we need at least those 10 days to 14 days in order to recolonize all the areas, intestine and vaginal area, and be sure that we will not have candida albicans and recurrent infection. And it's better to start 1 or 2 days before finishing the antibiotherapy, in order to be sure then we will take all the places and not avoiding any empty place for the candida or any other bad mycosis.
Okay. Thank you for the answer. It's important because there's always this question.
Yes.
They have a product, okay, with all these features, great features, and then how do they use, how they should.
For sure. Without having a clear posology and indication, it's hard to propose.
Yeah, so that's my question. But thank you for all the information.
Thank you very much. Any other question?
Yes, Dr. Adel, if I may, another question. My last
Yeah.
question.
Okay.
Let's assume that one lady started to ingest or take BellaVie WOMAN.
Yes.
Okay, what should she expect, and when?
Okay, you are talking when can she feels the results?
Yeah, yani what is the result that she will start feeling, and when?
Okay, usually in order to establish an eubiosis phase, if we are talking about like a support, like a food, we are talking about the menopause now. Okay, let's focus on our subject. If a lady will start before having her symptoms, then she will not feel anything because she will have less symptoms than other ladies. Now, if she have already the symptoms, she needs to wait at least those 10, 14 days in order to see, because we have to take off, we have to be sure then the inflammation is taken off, and re-establishing a good integrity of the intestine in order to start seeing the axis working well. And because usually, as I said, we have a proven link, two-ways link between menopause and estrogen level and the dysbiosis in the vagina and in the intestine. Okay, then in order to re-establish this good balance, we need those two weeks. And especially if we have symptoms, we will start with 2 capsules, as I said, per day.
Thank you, Dr. Adel. Very clear.
Thank you. Okay. Any other question, or it's okay? Anyway, we will be ready to answer. And we invite you, please, to go in our website. We have frequently asked questions there, and you can see some of the answers. And we are ready. I am ready at any time to answer your questions as well. Via email, via WhatsApp. As you know, I am reachable easily.
We have also the detailed aids which are ready, the 4 detailed aids that we can provide you, developed specifically for the menopause, as Adele developed today. We have also registered today recorded today the webinar and also the PowerPoint. So you will be able to see again and to check also all the documents. Okay, we can provide to all you, and you can get this report. But as Adele told, we are open for the follow-up for specific questions. Do not hesitate to send by WhatsApp, by email, by all system connection. Okay.
Okay, since we have no questions, I want to thank you very much for attending, for being so reactive, and hope we will do good business together.
Thank you very much.
Thank you.
Thank you. And we
Thank you very much.
Thank you. We keep in touch with you about the next webinar that we will present in the following weeks.
Thank
Sure.
you. Bye-bye.
Thanks.
Thank you all. Bye-bye.
Thank you.
Thank you. Bye-bye.